In this lesson, we'll continue our discussion of liver disorders by taking a look at cirrhosis, and then we'll finish up with liver cancer. So, cirrhosis of the liver is a chronic condition, right? This is something that happens over many years. And what we see is there's a progressive destruction of the liver, leading eventually to liver failure, right? This even can cause death. We can categorize cirrhosis into four different types. The first one is known as alcoholic liver disease, right? You can guess what's causing this. This is the most prevalent, right? This is the most common, right? So we see this in alcoholics. Then there can be biliary cirrhosis. Whenever you hear biliary, think of the bile ducts. So maybe there's an obstruction of the bile flow. Gallstone, that type of thing, or there's a stricture, a narrowing of one of the bile ducts. It can even be caused by an autoimmune disorder. Okay, so that would be known as biliary cirrhosis. And so the first one is alcoholic liver disease and then biliary cirrhosis. The second one is post-necrotic cirrhosis. This is one that would be associated with conditions like chronic hepatitis, right? Hepatitis C, that type of thing. Long-term exposure to toxic materials, right? Different chemicals and that type of thing. That can also cause cirrhosis. And then finally, there's something known as metabolic cirrhosis, where these are usually genetic problems where the liver stores different types of substances, and that ends up doing damage to the liver. So let's take a look at some of the main things that are happening with cirrhosis as far as the pathophysiology. Right, here's the gist of it. The liver develops extensive, diffuse, and highlight this word. This is the word of the day, fibrosis. And basically, guys, that means scar tissue. Now, as this scar tissue develops inside the liver, it starts to damage the normal organization of the liver. If you remember from anatomy and physiology, the liver, the functional unit of the liver is known as lobules, and there's a bunch of lobules, and they are they make the bile, they cleanse the blood, that type of thing. But with the fibrosis, the lobules become disorganized, right? So we start to lose their normal organization. Over time, the hepatocytes, the liver cells, they try to regenerate. The liver has the ability to generate, but they may not be really functional anymore because as the fibrosis occurs, the blood vessels in the liver become distorted, the bile ducts inside the liver become distorted, and that impedes the hepatocytes' ability to do their normal job. So we see these nodules. I have a picture here. I just want to show you real quick. You can see this is definitely a diseased liver. The liver is normally smooth, and all of these bumps, you see them all over the place. Those would be the nodules that we're talking about. Now, as fibrosis continues, right, it's going to interfere with even the blood supply going into the liver and the bile leaving the liver, and now the bile may back up. So that's going to cause a lot of different types of problems. Initially, as the fibrosis occurs and the whole pathology of cirrhosis occurs, the liver is enlarged. But as the fibrosis, the scar tissue gets worse, the liver is actually going to shrink. And you probably know that, right? What does scar tissue do? It usually shrinks, right? It pulls and it gets tighter. So the liver would eventually get smaller. The other thing about cirrhosis with the pathophysiology, even though these changes are taking place over many years or that type of thing, the symptoms don't really appear until they're well advanced. All right, so that's really a good picture showing you the nodules and that type of thing. So, since the alcoholic liver disease is the most prevalent, let's focus on that for our course, and see some of the things that are happening as far as the pathophysiology of alcoholic liver disease. We can divide this into three distinct stages. The first one is known as the fatty liver stage, and just like the name tells you, what is it doing? It's accumulating fat. Obviously, as we accumulate fat anywhere in the body, we're going to get bigger. So in this case, the liver will also be enlarged. The This stage here of the fatty liver, this is asymptomatic, meaning that the individual doesn't really exhibit any signs and symptoms. But if they did know that they were in this early stage of cirrhosis and they stopped drinking, this would be reversible. So that would be good news because the liver would go back towards being normal. If they continue to drink, they will then enter the second stage known as alcoholic hepatitis. And this is where we're going to see inflammation and necrosis, right? Cellular necrosis. And scar tissue is now going to start to form. So again, here's that word, fibrous tissue, right? That's the scar tissue. Once the fibrous tissue forms, it's irreversible. We can't get our normal hepatocytes back, right? So as we get more and more scar tissue, we're going to lose more and more hepatocytes. At this stage of alcoholic hepatitis, there may be some mild symptoms, and again, like we said, the symptoms tend to come on a little bit later. So at this point, if the individual stopped drinking, at least there wouldn't be any further progression, right? We may not get better, but there wouldn't be any further progression. Now, if they continue to drink and drink, then the fibrotic tissue is going to just keep replacing the normal tissue, and then eventually the function of the liver is going to become less and less. So the worse the fibrosis, the less functional the liver will be. Right? So eventually, little normal function will remain. So let's take a look at some of the effects that we see as a result of the loss of the liver cells. Again, if you go back to you think about all the things that the liver does for us when you were in A&P2, when you studied the normal function of the liver, right, you'll see a lot of this will apply as we lose the liver cells. There'll be a decreased removal and conjugation of the bilirubin. Remember, bilirubin comes from red blood cell destruction. It gets conjugated in the liver and then it gets eliminated in the bile. So that's going to be inhibited. There's going to be a decreased production of bile. There'll be impaired digestion and absorption of nutrients. Right? Decreased production of the blood clotting factors. Our liver makes the different clotting factors, so this individual would show even bleeding problems. Impaired glucose and glycogen metabolism. The liver, makes sure there's enough glucose in the blood. If we have too much glucose in the blood, then the liver will take that excess glucose and convert it to glycogen. That's our stored form of glucose. That's all going to be impaired. There's going to be impaired conversion of ammonia to urea. This is important. This ammonia is a byproduct of amino acid breakdown or protein breakdown. This is toxic in the body. So the good thing that the liver does is it takes this toxic substance and converts it to urea, which is a less toxic substance, and then we eliminate this in the urine. So if you ever walk into a hospital room with a patient with liver failure, the room many times will smell like ammonia because their ammonia levels are up. There'll be a decreased inactivation of hormones and drugs. The liver just normally will detoxify us from different chemicals and hormones and drugs. And this is one of the reasons that as individuals continue to get medications, they really need to watch their dosages, right? They needed to be monitored because, again, the old drugs are not being removed from the liver, from the body via the liver, right? So there could be a drug toxicity eventually. And just kind of going along with this, right, there's a decreased removal of other toxic substances also. Anything that we may absorb from our digestive system normally would be detoxified by the liver. Right, so all of this is really an important slide. All of these things that are happening here are the result of the liver cells not functioning properly. I have some more, but these are related to the disruption of the blood flow and the bile in the liver. Right, so these are some of the effects that we're going to see here. There's going to be reduced amounts of bile entering the small intestine. So we need bile to break down fats, right? It does emulsification of fats. So we're going to see impaired digestion and absorption. There'll be a backup of bile in the liver. That's going to lead to something known as obstructive jaundice, right? So here the individual now will start to have a yellow appearance, right? The eyes, the sclera of the eyes, the mucous membranes, the skin. There'll be a blockage of blood flow through the liver. And I have a picture that I'll explain this. This is going to lead to hypertension in the hepatic portal vein. We call that portal hypertension. And it causes a congestion of blood in the spleen. And whenever blood is congested in the spleen, that's going to cause an increased breakdown of blood in the spleen called hemolysis. Some other things, again, we're still kind of looking at things related to blood flow and bile flow disruption. Inadequate storage of iron and vitamin B12, right? The liver has the ability to store these substances. Congestion in the intestinal walls in the stomach, also impairing digestion and absorption. Again, I'll explain that in a picture we're going to look at in a moment. The development of esophageal varices. These are like varicose veins or hemorrhoidal veins that we would have in other parts of the body. The veins in the esophagus actually become engorged and they could actually burst and hemorrhage. And finally, the development of ascites, which is an accumulation of fluid in the peritoneal cavity. Again, I'm going to explain that on another slide. And this is going to cause the individual with cirrhosis to look like they have a big, like, beer belly, except that beer belly is not caused by like fat, really. It's more caused by fluid in the abdominal cavity, and that's known as ascites. Give that word a highlight. That's really an important word, ascites. So let's take a look at some of these things that we were just describing. So just kind of going over normal anatomy. These veins here would be like the mesenteric veins coming from our intestines. This would be, like the inferior mesenteric vein. This would be the superior mesenteric vein. Here's the splenic vein, some of the gastric veins. All of these veins normally bring nutrients and toxins to the liver. And they normally go through this vein right here. This is called the hepatic portal vein. And this brings the blood into the liver. And the liver now will process that nutrient-rich blood, but also any toxin-rich blood. And then that filtered blood will leave the hepatic vein and go into the inferior vena cava. But watch what happens. So with cirrhosis, these X's here kind of represent scar tissue, the fibrosis. When this liver is fibrotic, that slows the movement of substances from the hepatic portal vein into the liver, and the blood will back up. They back up into the superior mesenteric vein, they back up into the inferior mesenteric vein, it backs up into the spleen, right? Hence that's the enlarged spleen and the hemolysis in the spleen. It backs up into the stomach veins, that type of thing, and even the blood backs up into the esophagus, and that's what causes some of the like hemorrhoidal veins in the esophagus. All of this extra pressure inside these veins here cause also fluid to go into the peritoneal cavity, and that's what would cause the say in this area here in the peritoneal cavity, fluid to accumulate. So this condition right here, where there's increased pressure inside the hepatic portal vein, is what we call portal hypertension. Now, if you were to lift up your shirt right now and look at your abdomen and you see your skin, you don't really see the veins in your skin of your abdomen. On this patient, if you lifted up their, say, their gown or their shirt, you would see from all the back pressure in their veins, you would be able to see like a road map their veins in the skin of their abdomen because they're all engorged with blood. So that would be another thing that you'd be able to pick up. Just one more thing, these esophageal varices, again, a lot of times have to be monitored because they can rupture and burst, and that could be fatal. So a lot of alcoholics are being they're watched for that. All right, so this is really a good diagram. It kind of explaining how we're getting the portal hypertension. And again, the concept is the blood is not getting into the liver, so everything backs up. So let's just go back just to make sure we have everything. Okay, so we have congestion in the intestinal walls in the stomach, the esophageal varices, the ascites. I just want to go back one more. The congestion in the spleen, that's an important thing, and then the portal hypertension. All of those things we could see on this picture. So this is actually also a pretty good slide kind of explaining the development of the ascites. All right, so just one more time, the ascites is the accumulation of fluid in the abdomen. Bear with me one second. So here you can see how the individual's stomach is all swollen, right? That's not like, obesity. That's fluid in there, just kind of pushing the walls of the stomach out. Here's the word ascites. And so let's take a look at some of the things that cause ascites. So once the liver is damaged, again, by the fibrosis, we have a couple things that can happen. Let's go this way first. Um, the lymphatics in the liver can also be blocked by this liver damage. I didn't really put that into the notes. That also will cause a backup of lymph, and that will cause fluid to go into the abdominal cavity, so that can cause ascites. The portal hypertension, I spoke about that already. As the blood pressure goes up in the hepatic portal vein and then all the veins going to the liver, that increases the hydrostatic pressure. And if you remember from A&P2, hydrostatic pressure is a pushing pressure, right? It pushes plasma out of the bloodstream, and now the fluid goes into the abdominal cavity. The liver also produces albumin. Right? Again, if you remember from normal anatomy, albumin functions to draw fluid into the blood vessels. It creates an osmotic pressure, and if you remember, osmotic pressure is a pulling force. Well, if we don't have the albumin, that means we don't have enough osmotic pressure and we don't pull water into the blood vessel, and instead the water goes into the body cavity, and now it goes into the peritoneal cavity, and that's another reason for the ascites. Another reason for the ascites would be this. Um, Remember we said the liver inactivates hormones. If we don't inactivate aldosterone and antidiuretic hormone, both of these hormones retain water, we'll end up having elevated levels of aldosterone and antidiuretic hormone, and we will retain water. Well, where's that water going to go? Into the abdominal cavity. Okay, so we have four like distinct reasons for the ascites: the blocked lymphatics, the portal hypertension, the liver not making albumin, right? And by not having albumin, we don't keep water in the bloodstream, it goes into the abdominal cavity. And then by not inactivating the aldosterone and the antidiuretic hormone, that will cause water retention. So the ascites causes a bunch of different problems itself. It causes upward pressure on the diaphragm, and now the patient will have difficulty breathing because we again remember the diaphragm is our main muscle of inhalation. It'll cause the risk of an increased risk of peritonitis, which is an inflammation of the peritoneum, and then also impairing digestion and absorption. Okay, so both of these pictures are really good and to understand, right? So this is going to be again the development of the portal hypertension and its effects, and the development of ascites and again its effects. So now that we have somewhat of an understanding of the pathophysiology of cirrhosis, let's take a look at the some of the clinical manifestations. So like we said a little bit earlier, the initial signs and symptoms, they're vague. They're kind of vague. There's not a lot of them initially. So they'll have fatigue, anorexia, right, lack of appetite, some weight loss, anemia, diarrhea, right? That fits a lot of different things, right? That wouldn't tell you you have cirrhosis. And they'll have dull, aching pain in the right upper quadrant, right, where the liver is. As the cirrhosis gets worse, now we're going to start to see things. Again, we'll see the ascites, the backup of fluid in the rest of the body, right? The face, the legs, the arms, that type of thing. There'll be increased bruising. Again, we're losing those clotting factors. The esophageal varices, and like I said before, they will rupture, and that can even be fatal. There can be jaundice, and then even inflammation of the brain, encephalopathy. Again, think about like ammonia levels building up and things like that. Those are real toxic types of chemicals. So here's just a good picture, just adding a couple things to to the notes that we just went over. So there'll be the encephalopathy, right, causing confusion and the patient to be lethargic. They'll be yellow, right, that's the jaundice. They'll have pulmonary edema. Again, there's a backup of blood. Sorry, there's a buildup of fluid in the tissues, right? Everything's backing up. The skin will get these little what they call spider nevi. These little, you see these little blood vessels in the skin. The skin will become itchy. They'll have the esophageal varices. We mentioned that before. The liver becomes nodular. That was the picture I showed you. We'll have the ascites, distended abdominal veins. Like I said before, when you look at your belly, right? If you look at your stomach, you don't see the veins on your abdomen in your skin. In these individuals, you would see the veins all over the place. They just drew it a little bit here, right? You'll see it all over the place. You can have rectal varices also, not just esophageal varices. So you have, these would be like hemorrhoids, testicular atrophy and impotence. Right, this is related to hormones, increased bruising, the edema, right, the swelling in the legs, that type of thing. Females actually will have amenorrhea. They lose their menstrual cycle. Anorexia, nausea, impaired digestion, fatigue, weight loss, right? There's just things related to the digestive system. All right, so those are all, this is a pretty good picture too, just kind of showing some of the things. And then also the splenomegaly, I forgot to mention that. That was the enlarged spleen. Right, and then we get the hemolysis. And then I didn't put this in the notes, but males can develop gynecomastia, which is breast. So they would get breast tissue, again, due to the liver not getting rid of estrogen. Estrogen levels start to build up. So as far as the treatment, there's really not much we can do. We had said before, once we get to the cirrhosis stage, it's permanent, right? We're not going to get our cells back. So the individual, regardless, should stop drinking. Everything else is going to be supportive and symptomatic treatment. Just kind of basic dietary restrictions, making sure they don't have a lot of fatty foods, that type of thing. Making sure their electrolyte levels are normal. Paracentesis is where they take the fluid out of the abdominal cavity, so that helps to treat the ascites, if you want to add to that there. Antibiotics, emergency treatment if the esophageal varices rupture, right? That's a true medical emergency. Like I said, people can die from that, and the individual will probably go on to a transplant list. But just in my experience, again, I don't know if this is always the case, but a lot of times they never really get the liver transplant. A lot of times, the people that get the transplant are the people that didn't self-inflict the damage to their liver by drinking. So it's not that they can't get a liver transplant, but they're kind of low on the list. Okay, so that takes care of our cirrhosis. So the last thing we want to take a look at in this lesson is liver cancer. Now, liver cancer can be primary, meaning that it starts in the liver. But most of the time when we hear liver cancer, it's usually secondary or metastatic, meaning that it's coming from other tissues. Maybe it came from the lung, the breast, that type of thing. So secondary or metastatic cancer is much more common for the liver to have from other tissues. It arises from areas served by the hepatic vein or spread along the peritoneal membranes, right? So there's a lot of blood vessels going to the liver. So it's very easy for cancer cells to make its way to the liver. Now the cancer sets up in the liver, and we have secondary cancer. But what we're looking at here today is going to be primary carcinoma or primary liver cancer. We call this hepatocellular carcinoma. All right, this is the most common primary tumor of the liver, and it's more common in cirrhotic livers, so people that have this cirrhosis that we just spoke about. People that have hepatitis, right? Hepatitis C, even hepatitis B, and then people that are just exposed to different chemicals which are carcinogenic. So let's take a look at some of the clinical manifestations. Similar to cirrhosis, a lot of times liver cancer, the initial signs, there's really not much. So they're kind of mild and generalized. Nothing that would tell you, hey, we got a really bad problem with the liver. But some of the more advanced things would be anorexia, vomiting, fatigue, weight loss, Right, that fatigue and weight loss, right? Those are always like red flags to you. You know, if you didn't walk away with anything this whole semester, right? Fatigue and weight loss are just big flags of cancer of any type. Hepatomegaly would be enlarged liver, portal hypertension, again, increased blood pressure and that hepatic portal vein. These cancers also sometimes develop paraneoplastic syndromes, and that's where the cancer produces different chemicals and hormones, right? Inappropriately, right? They don't really follow the normal rules of negative feedback. Once the hormone level goes up and we don't need it anymore, a normal endocrine gland will stop producing the hormone. Well, in the cancer, the cancer will continue to produce the hormone even though we don't need it. So as far as the diagnosis, like I said, they're minimal early symptoms, so it's not really diagnosed very easily early on. Diagnosis usually occurs with more advanced stages, and the treatment is basically just chemotherapy. If it is isolated to one lobe, they could possibly take out one lobe, and they'll do even different types of radio frequency ablation, kind of like burning a type of thing. Okay. And there's just a picture. This, I believe, is from our book. This whole area here would be the liver cancer. Okay, so that concludes this lesson on cirrhosis and liver cancer. In the next lesson, we'll take a look at the pancreas and we'll look at pancreatitis and pancreatic cancer.